chemotherapy with or without immunotherapy or bevacizumab for EGFR mutated lung cancer after progression on osimertinib. So after progression on osimertinib, platinum doublet chemotherapy based regimens are the standard of care for patients with EGFR mutant lung cancer. Previously, the combination of chemotherapy plus pembrolizumab was examined in patients without EGFR or ALK mutation in phase 3 Keynote 189 trial, and that has demonstrated an improvement in survival outcomes. However, the combination of chemotherapy and bevacizumab also showed a survival benefit in molecularly unselected patients with NSCLC in the phase 3 ECOG 4599 trial. But the efficacy of all these treatment strategies for patients with EGFR mutation is unknown. So we know that, unselected patients, molecularly unselected patients with per se chemotherapy with chemo with targeted therapy have shown good results. But in these mutated patients, we still don't know whether we can use it or not. So basically, this is a retrospective study where they basically need to examine the outcome of chemotherapy with or without immunotherapy, as well as chemotherapy plus bevacizumab, each compared with chemotherapy alone in patients with EGFR mutant NSCLC. And the primary endpoint of this trial includes the duration on therapy and overall survival. So patients who are enrolled in this trial had EGFR positive NSCLC who had previously received osimertinib in either first, second, or third line setting, and then went on to subsequently receive platinum doublet chemotherapy with or without immunotherapy or bevacizumab. Additionally, those who continued on osimertinib were eligible for enrollment, and patients who previously received chemo, immuno, or targeted anti-angiogenic agents in the metastatic setting, as well as those with biopsy-proven small cell transformation, were excluded. So this patient with advanced EGFR positive lung cancer who had been on osimertinib and went on to receive next line platinum doublet chemo with or without immunotherapy or anti-angiogenic therapy before July 22 were retrospectively enrolled. The patient's demographics, treatment history, and outcomes, including time on treatment and overall from the start of chemo, collected by chart review, and they performed a log rank test to compare difference in time on treatment and OS distribution between the treatment groups. So these are the baseline characteristic by subgroup. So you can see almost the median age is around 57 to 64 years of age in all the three groups, that is the chemo plus IO, and chemo plus targeted therapy. And almost 65 like in chemo plus IO arm, the ECOG performance score is 100% with 0 to 1, whereas it is 35% in ECOG performance, 2 or 3, 35% of the patient where they received chemotherapy only, and almost 50% of the patient had exon 19 deletion, and around 48 to 53% of the patient have L858R mutation present. So coming to the results, a total of 75 patients were included, of which 29 patients received chemo alone, 12 patients received chemo plus IO, which is pembrolizumab in all the cases, and 34 patients received chemo plus anti-angiogenic agent, that is bevacizumab in all cases. No patients received all the three, that is chemo plus immunotherapy plus bevacizumab. So the median time of treatment was 3.9 months for chemo alone, 5.2 months for chemo plus IO, and 5.8 months for chemo plus bevacizumab group. For between the group differences, though it is not statistically significant. If you see the median OS from start of chemo, it was 12.8 months for chemo, it is 10.9 months for chemo plus immunotherapy, and it's 12.1 months for chemo plus bevacizumab. Again, it is not statistically significant between group differences. There was also no difference in time on treatment or overall surviving pairwise comparison between the three treatment groups. So to conclude, after osimertinib therapy, the addition of immunotherapy or targeted therapy, that is bevacizumab, to chemo in patients with EGFR positive lung cancer did not significantly improve clinical outcomes compared with chemotherapy alone in this cohort of patients. Thus, chemo alone seems a reasonable choice for these patients. Future research could examine larger cohorts and adjust for baseline clinical factors, and we'd also like to wait the results from ongoing clinical trials examining combination of chemotherapy plus immuno with or without immuno, with or without bevacizumab therapy. Thank you.